I knew something was wrong when I would wake up and my hands wouldn't work as good. I had no grip strength. Not long after that, it was my arms. I was like, you know, there is something seriously wrong here. I'm fortunate to have a great neurologist. So he did all the testing. The last was a lumbar puncture, and that's where he found what he was looking for, and that's where I got the diagnosis of CIDP. He was immediately on top of, you know, finding treatment options. I live in the mountains of Tennessee. Inclement weather happens quite often, and I have to drive an hour to an infusion center if that was the option. Unfortunately, someone would have to take me and bring me home just because of how it affects me. It's like I was swimming all day and my whole body feels like it weighs 500 pounds and I just want to lay down afterwards. So that would be another hurdle. Home infusion was a mutual understanding that this was the way to go. He found the drug and I felt better than I had in 10 years. They have a system where they send a nurse to your house. She showed me the first 2 weeks and then supervised me doing it. And then it was, I mean, it just became so simple that I showed the next nurse when I got a different drug a trick about once you put the needle in, you put medical tape over it before you put the clear tape over that so it's easier to take off. So, I mean, it was a super simple process. I like to be in control of anything dealing with my body. Doing it at home, I'm on the same schedule every day. I have a log. I have the time I do it, any medication changes, anything I need to tell the doctor. Everything is perfect, right, written down. There's no mistakes, no errors. Spinal cord injury in 2011 resulted in me being a paraplegic. And basically Medicare is your only option when you're deemed disabled as far as insurance goes. The first drug, you know, they had it might have been for a year, but it was a trial basis. And then it was covered under prescriptions. Unfortunately, I kept getting denied. My prescription coverage kept denying it. I got the first letter. I'm like, well, okay, appeal it. Got the second letter, appeal that too. I went 5 appeals. Finally, the judge ruled in my favor that they had to cover under prescriptions. Unfortunately, a couple of months later, the treatment got moved to Part B under doctors and hospitals. I'm not a doctor. I don't make a doctor's salary. My house isn't a hospital, so that made little sense to me. That took me out of the patient's assistance program that the drug had, that most of them do. That took me out of it because of Medicare. They didn't offer it for Medicare. So I was without treatment for over a month, and my symptoms came back tenfold. We basically were almost planning my funeral. And that's a hard conversation to have with your family. But I'm stubborn, so I was fighting it the whole time. Found a different drug. Everything's taken care of with that. I've been on it for 100 weeks now, so. And it does the exact same as the first drug did, so we're good. A lot of this stuff is extremely expensive. The first drug, I was gonna have to pay 10 grand a month when it got moved to Part B. I can't afford that. I don't know many people that can. I mean, it angered me, but it also made me very determined to make sure that nobody else goes through this. We went to DC and I got to talk to a couple of people in Congress and the head of CMS, and it was cool to actually sit down and talk to people that are in the field of what's going on with my life and tell them, like, hey, this needs to be fixed. There's something wrong here. There's a lot of people that think they get that first denial letter, that's the final answer, that's it. It's not. You just keep appealing it. Eventually, it will go high enough to where a judge will step in if they need to. And if that doesn't work, you keep going. You reach out to different organizations. Had the NHIA not gotten involved, I doubt I would be here right now. Be stubborn, have your options open, and reach out. Don't be afraid to reach out. Home infusion. If you have the option to do it, please do it, because it makes life so much easier.